Hello and thanks for joining us for Healthline 3. I'm Michelle Martin and today we're talking about the topic of erectile dysfunction with doctors Chris Cefalu and Jared Moss. Guys, thank you so much for joining us this morning. Well, they're going to be answering your questions for the next half hour, and of course we want to encourage you to ask what's on your mind. If you're online, just click on the Healthline 3 box. That's halfway down the right side of your screen. You can type in your question and just click submit, or you can give us a call. We love your calls. The number is 318-219-4569. We'll be taking your questions until 12:30. So guys, it's a subject that a lot of people kind of shy away from. They don't want to talk about it because it could be construed as embarrassing or misconstrued as embarrassing, but erectile dysfunction can happen to anybody.
Yeah, I think the biggest thing is it's the kind of the rule is that a lot of men, more men experience erectile dysfunction probably than don't. So the biggest thing for guys is you just have to understand that, hey, you're not the only guy out there with it. It's very normal. There's a lot of different treatment options, but if you don't see us or see your regular provider, then it's not going to get better. And there's actually some cheaper alternatives out there now. One thing that was a big dissuader in the past is they said, well, I went to get a prescription for Viagra and it was $500. They go, well, I mean, you can't afford that, right?
No.
So they would just give up. So there is generic Viagra that's available now, and there's options where you can get 30 tablets for $10. So it's a big difference as far as saying, wow, there really are affordable treatment options out there that can help me have a better relationship with my wife, significant other, things along those lines.
And I mean, we talked just a little bit briefly about treatments just now, but before we get that far down the road, people need to know what's causing it. So what causes ED?
Well, I would say that the most common cause of erectile dysfunction is kind of the natural things that everybody deals with as they get older. So age is one of them. Diabetes, high blood pressure, high cholesterol, not exercising, not eating right, all the things that your primary care doctor harps on you about every time you go see them. It affects everything. It affects your heart, it affects your brain, and it affects your penis as well. So
we've had a lot of smokers too. I have a lot of guys who refuse to quit smoking, and they come in and they're having severe erectile dysfunction, and I'll tell them, look, if you're smoking a pack of cigarettes a day, this is a huge contributor to what's going on. I've had a lot of guys that their final motivation to stop smoking is because it's contributing to erectile dysfunction, and a lot of those guys can see some improvements.
Right now, we actually have a caller on the line. We have Mary calling us. Mary, can you hear us?
Yes, I am.
What's your question for the doctors?
Okay. Do they know what causes urinary tract infection?
Guys.
well, that's a little bit unrelated to the erectile dysfunction topic, but nonetheless, there are a lot of different things that can cause urinary tract infections. It can be something just simple, that a bacteria got into your urine and you need a simple antibiotic to get over it. Other times there's things that need to be investigated more, things like having kidney stones can cause recurrent infections. Other problems like leakage of urine or postmenopausal female can be prone to more urinary tract infection. That's a very complex question to answer, and usually does require some additional testing and evaluation.
Mary, does that answer your question?
Yes, it does. Thank you.
You're very
Thank
welcome.
you, Mary.
All right, so again, this morning we're talking, or this afternoon, it's afternoon, guys, we're talking about erectile dysfunction and how it impacts life, what the causes are, and what treatment options are there. So we just talked about some of the causes, obviously a myriad. And you talked about smoking being a big one.
Yeah.
Why is that?
So I tell guys that, it's the nicotine, which is even in smokeless tobacco too. But nicotine is a vasoconstrictor, just meaning in simple terms it causes the blood vessels to constrict. So without being overly graphic, an erection is from blood flow to the penis. So if you're smoking and you have lots of nicotine, that it takes those vessels and it constricts them. So you're automatically reducing the blood flow to the penis. So it's actually really hard. And a lot of these guys, you can have plaque that builds up from smoking over years, and then the plumbing just is not working as well. I mean, for a simple way to put it.
And I mean, apparently, obviously, cigarette smoking, nicotine, doesn't just impact the
it's not just the lungs.
Not just your lungs,
It's
but
not
also
just the lungs. It
it's
absolutely.
a whole body impact.
And when I tell guys that, a lot of times they're just blown away and they're like, I had no idea. And there's many guys that that's been the tipping point for them to get treatment and then quit.
Not the threat of lung cancer, but the threat of ED.
So right, but,
yeah.
I mean, but that's the truth.
So speaking of the other types of issues that can lead to erectile dysfunction, we talked a little bit about diabetes. How does that work?
Well, You know, diabetes, we talked about all these conditions, diabetes, cholesterol, the smoking, the not eating healthy, all these things are diseases that ultimately affect the small blood vessels throughout the body. They end up leading to plaque formation, decreased blood flow, and that's, you know, that's what can set you up for a heart attack. You end up getting plaque formation in your coronary arteries in your heart, decreased blood flow to your heart, you can have a heart attack. Well, it affects your heart, affects your brain, it affects your kidneys, can cause renal failure in patients, and it also affects your penis. And so the small blood vessels in your penis get clogged up, and then, like Dr. Moss was talking about, without blood flow to the penis, you can't get an erection.
Guys, we want to remind you that you can still call us, the number right there on your screen, 219-4569, for any questions that you have about ED. The doctors are here, they're on your side, and they want to help you with this situation. So we talked about some of the causes. Let's look at treatment options. A lot of people are that's a sensitive area for them. That's a sensitive subject for them. They're afraid of what's going to happen. Put these minds at ease.
So I think the biggest thing, and we touched on this a little bit earlier, is affordable treatment options. So when you talk about medicines like, and there's a lot of different medicines. There's Viagra, Levitra, Staxin, Cialis, lots of different ones. But the biggest problem for people is they go, well, thanks for the prescription, doc, and I'm glad that that works for some people. But when I go to my pharmacy and the pharmacist, you know, my insurance doesn't cover it, and they tell me, well, $500, that's not an option for me. So we do have Viagra that's generic now, and again, there are some places you can get that 30 tablets for $10, which for most folks is a game changer. Cialis, we're hoping, is going to be generic possibly this summer and later. That's another erectile dysfunction medicine. We usually start with the oral medicines and to see if that works. If that works, and we usually stick with that. If that doesn't work, there are other options like penile injections. And most of the guys go, oh my God, that sounds like the worst idea ever.
I'm not a guy, and I flinched. I'm not going to lie.
It just, most of the guys, they look at you like you're crazy when you tell them, and you go, no, wait, hear me out. We teach guys how to do this all the time. It's a diabetic needle. I mean, the needle is about this big, and you inject it into the base of the penis. Yeah. And it's really not a painful thing. For instance, I taught 3 guys this morning how to do it in the clinic. So it's very doable. And almost every guy goes, really? That's it? That's all I have to do? And I go, yeah, I told you. It wasn't as bad as you thought it was going to be.
Right now, we have another caller on the phone. It's John. John, are you there?
Yeah.
What's your question for the doctors?
Well, I had a stroke some while back, and ever since then, I haven't been able to get an erection. So, and my doctor gave me a prescription for something called sildenafil, 100 milligrams, and that didn't work. I was wondering if that's the same as Viagra, or if Viagra would maybe do it.
So I guess I'll take that one. So, and it's John, correct?
John.
So John, that's a great question. I think there's a lot of guys out there that are going, man, I'm glad John called in with that question because I'm wondering the same thing. So sildenafil is Viagra, okay, number one, and 100 milligrams is the maximum dose. You know, with a stroke, it can be a combination of you may not have the nerve signals that are being sent to the penis. That may be one of the reasons why you're not having good erections. Some of the other options would be to try a different type of oral medicine to see, well, maybe the Viagra didn't work, maybe we can try another option. But if that ultimately doesn't work, we probably need to come in, you'd need an exam, need some blood work, and then talk about some other options. If the oral medicines are not going to work, that doesn't mean that it's the end of the road. You might be a candidate for a penile injection, and then we typically talk about penile prosthesis, which is the surgery to fix it permanently, usually as a resort when the less invasive options don't work.
John, do you have another question? Did that answer your question?
I have to think about it for a second. Yeah, so that is Viagra, he said.
That's correct.
Okay. So now with the penile injection, does that go into the vein or just the base of the penis?
Yeah, so that's another good question. A lot of guys actually are fearful that they're going to have to inject the head of the penis, which I think every guy goes, hey, that sounds like a terrible idea. But it's actually the base of the penis, and it's not like you have to, you know, guys are worried that, oh, well, what happens if I inject the wrong spot? And I tell them, look, we're going to show you how to do this. We teach you how to inject. We don't just give you a medicine and tell you to go home and do it.
Good luck with it.
Right. You don't do that. We show you how to do it in the office. We will administer your first injection and make sure that you're comfortable before you leave. But it's not as hard as trying to find it's a vein. It's a very, very, very safe way to treat it. And I'm telling you, it works great for a lot of men.
So So it's like skin popping then?
No.
Something like that? All right, well, I'll talk to my doctor about it.
Thanks, John.
Thank you.
So John already has a doctor that he's currently talking to. What if guys are at home, they're not comfortable making the phone call, they're not comfortable getting online, asking the questions? How can they reach you guys, call you in your office, ask these questions?
Well, I think the simplest way is to just set up an appointment and come in and get evaluated. The hardest step a lot of times is just making that first reach out to say, hey, I've got a problem. Is there something you can do to help me? And it never fails to amaze me. I'll have patients that I'm seeing for years that I've been treating for other various causes, and then, you know, years will go by, we're taking care of that, they're doing well, and last time I see them, you know, we go through the entire appointment, and then they kind of get to the end and their wife's like, hey, ask them, go ahead and talk to them about it. So, you know, it's hard to bring up, and it's completely understandable that it's hard to bring up, but I think it's important to know we do have options, we can help you, but only if we know there's a problem.
All right, right now we have Philip on the line. Philip, can you hear us?
Yes.
What's your question for the doctors?
Okay, I got a script of Viagra from my urologist, and then shortly after that I read on the internet where some people it was causing permanent blindness in some people. Can you elaborate on that?
Yeah, Philip, so this is a very, very extremely rare side effect, and I've never experienced it in my own practice, nor have I actually ever heard of anybody having this. But temporarily, usually it's not permanent blindness. It's an ischemic artery. It's kind of a, I forget the abbreviation for it, but it basically causes a constriction of the artery that goes to the retina. It's very, very rare. I've never seen it result in permanent blindness for any man. And usually we'll talk to men, you know, if they have an eye condition, it might be something where they would want to avoid it. But generally, if you don't have any eye conditions or any eye concerns, it would be a safe medicine for you. And if there were any concerns, I would say talk with your ophthalmologist about this. You would actually need to see an eye specialist and say, hey, I have a urologist. He's prescribed me this medicine. I read about this side effect, and he thought it would be very safe for me to take. You know, could you examine my eyes and just make sure I'm not going to have any problems here? That would be another alternative. But I can just tell you, in practice, I've never seen that.
I've never seen it. I've never heard of anybody seeing it, honestly. Yeah. It's been reported, and unfortunately, every medicine you take, including things like Tylenol and ibuprofen, can have side effects. But it's important to talk about side effects of the medicine. And, you know, some more common side effects that you can see with these is it can cause a change in vision. Sometimes we'll have patients that talk about seeing kind of a blue hue while they're on the medicine. Sometimes it can cause headaches or congestion. And some patients, when they take it, they just don't feel well and don't like the way it kind of affects their head. They get some bad side effects to it. And if that's the situation, we can kind of try to back down on the dosing or try one of the other alternative medicines. But there are side effects to any medicine you take, and it's always important to discuss those potential side effects.
Okay. Well, thank you very much.
Thanks, Philip. Appreciate it.
Philip. Now, we were talking about side effects and things that can happen. Are there any other risks associated with Viagra? And bringing up that question, you said they see a blue hue. Sometimes some patients will see a blue hue on Viagra. How long does a person have to take Viagra? Like, how long does that prescription last?
So I guess it depends on how long you write it, but usually, you know, if we say that the erectile dysfunction is a combination of diabetes, high blood pressure, cholesterol issues, a lot of times, you know, the Viagra, it treats the symptoms. It doesn't treat the cause, right? So if you have erectile dysfunction, I usually tell my patients we're not getting any younger. It's unlikely, unless you make some significant modifications in lifestyle, that you're going to see, you know, a drastic improvement where you're not requiring those medicines anymore, but it is possible. So typically I'll write a patient and give him 5 or 6 refills, but most of the time it's a medicine that they take as needed to have sex. Yeah. And sometimes guys will tell you, I don't always need it, but sometimes I do. So I just tell the guys it's a very safe medicine. The only medicine that is really contraindicated for any of the medicines like Viagra and Cialis is nitrates for chest pain. Okay. That's the only medicine that really can say, hey, there's a real danger here to taking these two medicines together. And so that would be men that say, I have known heart disease, I've had a heart attack in the past, I have to carry my nitrate tablets with me, and I have to take those underneath my tongue if I'm having severe chest pain. And it's actually pretty rare these days that patients have to carry these medicines, but that's the biggest one that you have to be on the lookout for.
All right, right now we have Donna on the line. Donna, can you hear us?
Yes.
Donna, what's your question for the doctors?
Yes.
My husband is 64. A couple of years ago, he had a stroke, not a severe. He is doing fine, but that's when he started having ED problems, and now he has ED. So I was wondering what their recommendation is.
Yeah, so Donna, I would say in this, you could start with by having him come in for an evaluation. He could see one of us. He could see a urologist. He could start even with his primary care doctor, and usually it's just kind of an assessment to. Sometimes we'll check some blood work and go through and talk about some of the different treatment options for him. And again, we would start with the lesser options, trying some of the oral medicines, assuming that this is going to be a safe medicine for him to take. But sometimes in patients that have had a stroke, it can be a multitude of causes why they're having erectile dysfunction.
Donna, did that help you at all?
Yes. Yes, it is.
Do you have another question?
No, that's all.
All right, Donna, thank you so much for calling.
I think it's, one thing to talk about, this just came to me, is the way you take the medicine. I think that's important. For the vast majority of these, you take them on demand, meaning before you want to have sexual activity, you take it about 30, 45 minutes beforehand, and it doesn't work automatically. It doesn't perform miracles. You still have to do the things you normally do, but it helps out. Whereas one of them, the Cialis, there's a daily dosing that you can take every day. You don't have to actually plan it, which is one of the benefits about it, and it just kind of builds up a normal level in your body that's always there, so it's kind of available whenever you want to, which a lot of people love, understandably so. You don't have to plan it. You don't have to think about it beforehand.
Right.
Does the Cialis pose any more significant threats or risks than the Viagra?
Not really, and in fact, it actually has some benefits for enlarged prostate symptoms such as going to the bathroom frequently, urgently, waking up at night. We incidentally found that men who are taking the daily Cialis see a pretty significant improvement in Cialis. So Cialis is actually also indicated not just for erectile dysfunction, but as well as BPH.
When you say BPH?
Sorry, an enlarged prostate, benign prostatic hyperplasia.
All right.
I apologize.
No, that's fine. I'm breaking it down for everybody. Now,
I was just going to say, it was just kind of, to Chris's point, it's one of the few medicines that men can take daily to help them pee better and have better erections.
Yeah.
So,
2 for 1 deal.
Yeah.
Now, this is where maybe the hitch in the giddy up is. There's a generic of Viagra, right? Is there a generic of Cialis yet?
Not at this point.
No.
Okay.
There's a few alternatives. There's some compounding pharmacies out there that make a very similar version that we can use. That is a way to get around it slightly. But like Dr. Moss said earlier, hopefully around September is when I'm told Cialis will be going generic, and that will obviously make life a lot easier for a lot of patients.
Change the game. Now, since we're talking about the cost of medicine and I guess the cost-benefit analysis, if you will, are these medicines typically covered by insurance?
Yeah, so they're typically not. In the rare instance, like the one thing that Chris was alluding to is daily Cialis. If you have some urinary symptoms because of the prostate and you're not urinating well, sometimes we can see that the insurance will cover it from a BPH, so a prostate standpoint. And oh, by the way, as a benefit of that, you're actually having better erections. So the insurance companies don't.
I mean, I have had some luck with some patients and their insurance companies, but it's highly variable and highly variable about how much they will cover, even if they do cover it. So, everybody's insurance company is a little bit different, and they send you out that list of 5,000 medicines that they do cover and don't cover every year. So you can always refer to that.
Through it.
Yeah, but some insurance companies do cover it, but for the most part, no, unfortunately, it's not.
All right, so back to figuring out if you have ED. I imagine that it's pretty straightforward, but do you have to have some sort of blood test?
That's really a good question. I think that's the biggest thing that a lot of patients want to know is, blood testing. A lot of times I will check a testosterone on men, but the biggest thing that I try to tell my patients is that, generally speaking, erectile dysfunction and low testosterone are really 2 separate issues. And men really will conflate the two. They'll say, well, maybe if I'm not having good erections, it's probably because my testosterone is low, and if I get that up, then maybe my erections will improve. And a lot of times patients will come in to see us, and they've been placed on testosterone. They go, well, my libido, my desire for sex is up, but my erections really haven't changed. And I'll say, well, generally speaking, that's because, it's a blood flow issue, and giving you testosterone is not necessarily going to increase the blood flow to the penis. So it's important. So a lot of times we will talk to guys about it. If the testosterone is low and they're having other symptoms, a lot of times we will use testosterone replacement in those men, but they just need to understand that testosterone is not really indicated to improve erectile dysfunction. If the men see it as two separate issues, it'll help. But the other thing is sometimes patients will ask if there's any invasive testing that's needed. There's usually not. Most of the time we can just do a history and a physical exam, and you don't need a lot of invasive testing other than just some random blood test.
Now, I just said it might be a pretty straightforward, indication if you have ED or not. I don't know. It's not my experience as a female, but maybe there are men at home that they're having ED or they're experiencing some sort of ED symptom and they don't recognize it as this. They just think, oh, I'm off today, or oh, I'm tired. How do they know the difference between an occasional situation or a real problem?
Well, I think it's twofold. One is it continuously happening and getting worse? Because erectile dysfunction typically presents that way. It doesn't just happen once or twice all of a sudden. It's a progressive disease. It slowly builds up over time and it slowly gets worse. And the second is recognizing, well, what exactly is it and what do you mean by erectile dysfunction? Well, it can mean a lot of different things, and it's different to every person out there suffering with it. One, it could be a difficulty getting an erection, or it could be a difficulty maintaining an erection. So some men can get an erection without any problem, but then it lasts for a few seconds and just goes away. And so there's a few different ways it can present. And I think for the men that are suffering through it, they very clearly recognize that there's a problem going on.
So we've talked about the oral medications, we've talked about the injection and how it's not as scary as it seems, and they'll show you how to do it. What happens next? What if the injection doesn't work?
So sometimes that does happen. Sometimes either the erectile dysfunction is so severe that the injections don't work, or a patient tries it and they go, you know what, I don't like doing this. I'm not good with needles. This is not going to be a good option for me. Typically at that point in time, then we'll discuss surgical options. One of the things that's nice is a penile prosthesis is typically an outpatient procedure that generally is covered by insurance, and it's a permanent solution to erectile dysfunction. It is surgical, so usually we like to have exhausted all of the other non-surgical options first before we proceed to a penile prosthesis. But it is a great option for men with severe erectile dysfunction. Again, outpatient, covered by insurance. It's a natural feel. If they go to the gym and take off their clothes, nobody knows that they have one in. There's a small pump that's placed in the scrotum that's in between the testicles, and they will actually inflate the cylinders, which will give them an erection. They're able to have sex. And then when they're through having sex, they can hit the deflate mechanism, and it goes back to being normal.
So there's no, like, extra equipment that goes with it. Everything's internal.
It's all hidden on the inside. Yeah. So I think a lot of people feel like, oh, I don't want a penile prosthesis because I don't want to be a freak. And it's like, actually, if you didn't tell somebody, they wouldn't know.
No, I have no idea.
It doesn't interfere with orgasm, and it doesn't interfere with ejaculation or urination. So it's completely hidden.
So I was going to ask about that particular mode of treatment, if it had an impact on the end result, if you were able to, finish what you started.
That's exactly right.
So to say. So you just said that you don't even have to tell anybody if you have that procedure done.
No.
But maybe we should be talking about this more.
I think that's fair. I know we certainly feel that way in our practice, and I mean we feel very comfortable talking about it. But it's still a stigma sometimes with men. Maybe they don't feel like they're quite as macho if they admit that they're having some issues with erections. But I think it's super common. There's great treatment options, and you can get better if you want to.
Well, I think there's a few things that kind of limit access, and there's several reasons. One, maybe the person, their primary care doctor taking care of them, doesn't realize that there are other options besides the medicines that they try, and they try it doesn't work, and say, I'm sorry, that's all I can offer you. Sometimes the men don't really know what it is that we're talking about. They think, oh, we've got a penile prosthesis, you're going to completely replace my penis, I'm going to have this huge thing I've got to carry around, it's going to be very awkward, my wife or my girlfriend's going to not want to have sex with me anymore. And that's not true at all. It's completely different. So getting educated about what it actually is and how it works is very important to really understanding it. Once you explain it to people, I think a lot of times it really sinks in. Oh, this is actually quite natural, and when you do it, you get a very natural erection, and everything beyond that works just the same as it did beforehand.
So I guess the first step is saying, hey, noticing a problem and seeking out help. So. Absolutely. you guys work at regional urology. I don't imagine that you spend the entire time talking about ED. How much of your practices is dealt with that?
You know, I think it's different. Chris does a lot of ED, but he also does a lot of our cancer work. I would say my practice is a little bit more geared towards men's health. I bet you 60 to 70% of my practice is erectile dysfunction.
So it's
very
relatively
common.
Yeah, super common, nothing to be ashamed of. Now, speaking to the cancer aspect of it, I assume you deal with a lot of prostate cancers. The after treatment and during treatment with prostate cancer, I know a lot of people who are dealing with this particular situation, they find that they're not able to perform or that they're suffering from ED, for lack of a better phrase. Is there hope? Does the same treatments work for people who have had the prostate removed?
Yeah, absolutely. In fact, after prostate surgery, when we remove the prostate, we actually will put men on the erectile dysfunction medicines right off the bat in a rehab program, so to say, to help stimulate recovery. Radiation treatment for erectile dysfunction or for a prostate cancer can cause erectile dysfunction as well, although that's a bit less common and tends to happen down the road. But the treatment options are the exact same if you have erectile dysfunction related to prostate cancer, or if it's just organic in nature, meaning that it's related to your diabetes or smoking or cholesterol or whatnot. So there are options for you if you have prostate cancer, and they're the exact same.
I saw a guy today that had his prostate removed in May of 17, so May of this year it'll be 1 year, and I saw him and he came to see me because he was still having lots of issues with erectile dysfunction. He was interested in a penile implant at the time, and I said, look man, you're still very early in this. You've got a lot of room for your nerves to recover. And I said, why don't we try some of the other options? And we started with the penile injections and said, look, let's just give this some time before we try to do a permanent surgery. And I saw him back today, and his erections are already starting to recover. He's using, even he said he's starting to get erections back and not having to use the injections anymore. So, I mean, it's been a really good, to see this gentleman, all the way through and really starting to recover his erections to not needing surgery and hopefully not needing medicines.
Now, we've talked about medicine, we've talked about injections, we talked about prosthesis. A lot of the things that can lead to ED are impacted by what goes into our bodies, maybe diet, exercise. Do you guys put patients on any kind of regimen like, hey, eat this, go running, go walking, let's do these things in conjunction with this?
I mean, it's something I think that we talk about for sure, but I think sometimes it's it can be tough for patients to make drastic lifestyle changes, to lose 50 pounds, or if they're not going to the gym, get to the gym 3 times a week. Definitely something that we encourage patients to do. I don't have a specific diet that I put people on, but I do talk to them about being overweight, smoking, lack of exercise, those things that are modifiable that, it can help them avoid other options. And even if they have some erectile dysfunction, maybe they can get some improvement or certainly limit it from becoming more progressive, especially if they're willing to make those lifestyle changes.
Now, have you guys ever had a patient that came in and instead of doing the Viagra, the Cialis, the injections or anything, you've seen a change just with diet and exercise?
I would love to say I have, but I don't think I actually have seen that.
Yeah, it's tough because I think that goes back to the problem of we're still not seeing men early enough in this. So if we start to see these men where they're saying, hey, occasionally I'm really having some trouble getting an erection, maybe I'm in my early 40s, but instead maybe that gentleman's embarrassed and he doesn't make any lifestyle changes, and now he comes in at 65 and he's got severe erectile dysfunction now. So I think some of that is it's a little bit okay on the education end, and men just being unwilling to come in, kind of like for the other things that it's the old adage, if you catch it early, right, you have more treatment options. So once somebody has more progressive erectile dysfunction, it's just going to be much harder to recover that.
So early detection, ED should go with ED.
Yeah, I think that's fair.
And again, the stigma surrounding it is, I mean, if we can sit here for 30 minutes and talk about this, then you should, if you're at home and you're suffering from this, pick up that phone, make the phone call that you need to make, and get the help that you want, or that you desperately need.
Yeah, absolutely.
So if the people at home want to reach out to you guys, is there a number they can call, or should they just head out to regional urology? What's the process?
I think the best way to do it is our telephone number is 683-0411. You can call. A lot of times a referral is not needed. That's a question a lot of times patients will ask, do I need a referral? Usually that's determined by your insurance, but most of the time you don't need a referral. We do take in walk-in appointments. It just kind of depends. So we occasionally will have patients walk up and ask to be seen.
Yeah, I would recommend calling the number, and you can also visit our website, www.regionalurology.com. We have a lot more information to cover all the topics we've discussed today, as well as some pictures and graphs to show you a little bit more information if you have more questions.
All right, guys, thank you so much for joining us for this Healthline 3. A lot of interesting and informative things that we've shared here today. And if you want to know anything else about this, visit our website, ktbs.com.